You have been listening to the OMG podcast with Paul Finkelstein. We can help you build wealth without hogging your time. Schedule a one-on-one with us. Thanks for listening. Join us again for another OMG podcast segment.
Hi there, everybody. This is Paul Finkelstein. I hope I'm not too loud. This is with OMG Biz Cafe Live Talk Radio, where we have small business owners, entrepreneurs, workaholic professionals from all of Southeast Florida and maybe a little bit north of us. We'll find out from our next guest, Suzanne Barrett. Are you there?
I am here. Hello there. How are you?
Wow, it's great to have you and experience you on a live call where you are broadcasting now on my LinkedIn and YouTube. And I'll share that with you later. I'll text you. But your specialty is medical billing. Is that correct?
That's one of my specialties, but yes, medical billing.
Okay.
The mystery that it is.
Okay. So let's dive in, and the questions might get harder and then easier, or start off easier and get harder, depending on what my secretary put them in the order. So the first question we have queued up is, what is the primary purpose of medical billing?
All right. Well, the primary purpose of medical billing is for your provider to be paid for the services from your insurance company, so that you don't have to pay 100% out of pocket for that expense. And so the insurance biller, so the person that would be working for the provider, would submit a bill or a claim, as what we call it, to the insurance company, so that the insurance company can read our hidden secret language to understand what service was provided and who is supposed to be paid. And so with that, the behind all the scenes, you saw your provider for whatever it might have been, for a health checkup or a twisted ankle or whatever it might be. And the provider sent in a bill, or for us a claim, for him or her to be paid for that service according to what the person's contract is.
Now, Suzanne, how does the medical billing process begin?
Okay, so the medical billing process actually begins with the first phone call that the prospective patient makes to the provider to schedule an appointment, to schedule, to be seen again or what have you. And when that person answering the phone asks, can I have your insurance information, your date of birth, your current address, etc., that's actually where it began. So it actually begins like way before where anybody would even think. And so all of this information is then verified according to how the insurance company has that patient listed. So for example, you might think that you live at 123 Main Street, but the insurance company has you living at 8910 Main Boulevard, or whatever the situation might be. And so when the claim is submitted, we have to have the information matching from what they have you as, not where you might be currently at. So the side note to that is always make sure that your insurance company has the most up-to-date information. Now, that being said, the most mistakes that occur in any kind of insurance billing are right there at the beginning. So someone could write down the wrong date of birth. They could write down the wrong insurance ID number. They can misspell your name, very simple things like that. And then the claim will deny, unfortunately. And so, but that's where it all begins, is right there at that first phone call, when you're giving all that information to the providers when you're scheduling that appointment.
Speaking of which, what role do healthcare providers play in medical billing?
With the provider, there's different roles that they may play. And many of this is not actually done by them. Many of this is done actually by the either the person who's scheduling the appointment, or the person who is filing the claim, or the person who is coordinating an authorization if it's needed for that type of a of a visit or a service, in case, especially if it's for an operation or something like this. So the provider actually is, they know that they're seeing, for example, Mary Smith today. And so they walk into the room and they may not actually know why they're seeing that person. And so, so the provider garners a lot of information from that patient. And so it's very important for that patient to be very forthcoming to the provider in order to receive the proper services that need to be done. Now, that provider, lately, let's put it this way, lately, providers are becoming far more educated in regard to what their services mean. And as the standards increase for documenting what service was provided, that will determine what type of billing or service is billed. And so originally, their documentation requirements started in 1995. And that's where CMS, the Centers for Medicare and Medicaid, they came up with a criteria, as well as the American Medical Association, to determine what actually constitutes different visits and different levels of visit. And so the provider now needs to know, okay, this person came in for, let's say, a cold. What service am I providing? And then that would actually translate into a code. And that's that secret code that all of us billers speak in regard to conveying to the insurance company what service was provided and what the intended reimbursement should be. So what that provider should be paid. So whereas years ago, the provider had no, or very little input or involvement in that. And now, thankfully, they're providing more training to the individual providers, so they know what service equates to what level of billing it will be.
Okay, let's dive a little bit deeper here. So can patients be billed directly, and how does that work?
Okay, billed directly there's different ways that can occur. Do you have any specificity in regard to where you're going with that?
No idea. My secretary just told me I should ask it.
Your secretary throws questions at me all the time, doesn't she? So, okay, so there's different ways that a patient can be billed. The first one that they can be billed is if they have a copay. So if they have insurance, and let's say they're going to their primary care physician, and their insurance plan contract says you have a $10 copay. And let's say, for example, you go see your doctor and you forget to pay your copay, then the medical provider can bill you for that $10 copay. If you have a deductible, but you're not sure, or the person who's checking you isn't sure what you're going to be billed, they'll send you an invoice or a bill. So the patient will receive a bill detailing the services, and they will pay that invoice based on what the insurance company quantifies that service to be. So for example, if you have, let's say, Florida Blue, and you go for a follow-up visit, they're going to say, okay, this follow-up visit equals this much that you owe. And so the doctor's not going to charge you the full amount of what they would charge a cash paying client. You would receive the same discounted amount that the provider has. So that's his contract amount, you're paying his contract amount. Now, there are times when a member might receive a bill if they're out of network with that provider. And so, some people say, well, I would never use an out of network provider. Why would I do that? And the fact is that many people do, because they either like that provider's been with them for 10 years, or they have an established relationship with them. They end up, having a bill that may not be alike, similar, etc., to that in-network situation. So, for example, if I went to my orthopedic surgeon, who I've been with for forever, but he is not contracted with my insurance plan, he is going to send me a bill that I'm going to have to pay. And so I might have to meet a deductible. I might have to meet a higher deductible than if I was in network with if my provider was in network. or whatever my payment agreement might be. So there's several different ways you might receive an invoice or a bill as a patient. And by the way, these are due. These are expected to be collected, especially if the doctor or the provider is in network. Their contract requires the doctor to bill you for those patient responsibilities.
What information is typically included in a medical bill?
Okay, well, the obviously the first thing that's going to be included in a medical bill is going to be the data service. And so obviously look at these invoices that you receive from your doctor. Make sure you agree with them, because sometimes you may not agree with them. You may say, well, wait a minute, I saw the provider on March 25th, not March 26th. And so definitely call your provider and make that clarification. And so they may have transposed a number. They didn't have their glasses on when they were, entering the dates of service into their computer. You never know. So obviously, if you receive an invoice from your provider, always look at it and make sure that it matches with the actual information. The second thing that's going to happen is they're going to give you a description of the services. Sometimes it's going to be very vague. You might see that it was a professional services, or you might hear it's a level 2 visit, which means very little to most outside people. If you ever have a question, again, with regard to what service was provided, always call your doctor for clarification. That's what, their office staff are usually very helpful, and they're going to provide you, the description of what was being submitted to the insurance company. Now, what also is included is the charge that they're charging the insurance company. Now, this charge is going to be the same for everybody. So if it's a level 2 visit, everybody gets charged the exact same amount. However, the amount they might get paid by the insurance company might differ per insurance company. And those are by the contracts that provider has with each different insurance company, whether it's Florida Blue, it's Cigna, it's Aetna, United Healthcare, everybody, those numbers may differ. Now, there's something that might be on the bill that says an adjusted amount. Now, that adjusted amount means that the doctor cannot charge you that amount. So you may receive the charge may have gone into the insurance company is $125. The doctor got paid $110.82. The adjusted amount was $9.18, and then that leaves a $10 amount, which would leave your $10 copay. And so some of this is, sometimes your doctor bills are very specific, and sometimes they might just say the date of service, for example, March 25th, 2025, and it'll say professional services, and it just says $10. So you don't know of any other information that's involved in that. And you should know. You should know how that charge was submitted. You should know what the allowed amount was for that doctor. And you should know what was adjusted off of your bill and how that $10 final net amount was arrived at. You have the right to know these things.
Now, Suzanne, I know it takes a long time to learn Chinese or a language or Hebrew or Japanese. And if you were to learn Chinese or Japanese, how long do you think it would take you to learn one of those languages? Considering I'm assuming you don't speak one of those languages.
No, I don't speak those. I don't speak those. So as a youngster, I'll go into my child psychology degree. As a youngster, I could learn that a lot quicker. As an older person, it takes a lot slower because our brains just don't wrap around, learning languages as easy as when we're younger. However, I jokingly tell people that, we kind of speak in a secret agent code. And so it is a language unto itself. And so, I might say, oh, well, this person was seen for a 90837, or the person was seen for a 99214, which means absolutely nothing to another person. But however, in billing, that tells me, that's that secret code that tells me what I'm billing the insurance company for. That describes the service that was provided.
Right. And
And then
that
in
leads
this,
me to the next question, which is how
uh-huh.
do billing codes impact the billing process?
Oh, well, it's quite, that's a very good question. So the billing codes actually tell the payer, it's a language that they all speak. So every time that code I was telling you about, like that 99214, I can utilize the same code, which remember that describes what type of service was provided. And so in describing that service, I can send that exact same code to Florida Blue, to Anthem, Georgia, to Empire Health Plan, to Cigna, United Healthcare, everybody understands what that code means. That's the language that they speak. So I need to speak that language too. And this language, these codes are established again by the American Medical Association, so that so that we all speak the same language.
Now it's about the 16-minute mark, and I didn't know if I wanted to consume your entire lunch hour. Would you want to go for another 3 more questions, or I have 10 more, or we can go for 20 more questions and then be done?
Well, I'm happy to help you out. No, I'll be happy to help you out. You tell me what you need, and I'll be happy to answer it.
Sure. We'll go a little bit further. So, I mean, here's the next question is how do insurance companies determine what to pay for a claim?
Oh, that's a good question. So each provider, we call it being in network or contracted with the insurance company or the payer. And so some of them are negotiable, some of them are not. But each insurance company has their own math system in order to determine what they feel is an appropriate amount to pay for a certain service. So, and everything to them, like I look at spreadsheets all day long, they have massive spreadsheets. And so using actuary and science, which is basically the science of math, they basically will say, okay, that code I used before, that 99214, which is a doctor's visit, when you go see your primary care practitioner. So they feel that, let's say that doctor who is a medical doctor should be paid, for example, $115, and that's their rate. And so that rate could be the same across the United States. It could be based by the zip code. It could be based by the state. It could be based on Medicare reimbursement. But each insurance company has their own equation, if you will, as to how they come to that final number of the $115.
Okay, so what skills are essential if somebody wants to be a successful medical biller?
Okay, so that's an excellent question as well. So if you are interested in trying to break into the billing world, there's multiple ways to do this. One, there's always the School of Hard Knocks, which, is always a good way to do it. If you want to be a certified biller, there is actually an organization that is, their abbreviation is AAPC. And AAPC will actually help people to be certified. They provide the education, and they are an accredited body. And so that is the American Academy, and it says it's actually American Academy of Professional Coders. But you can go on to aapc.com, and they will have multiple different types of certification programs that you can subscribe to and participate in that education. And this AAPC certification program is very well recognized all over in regard to the type of courses that they offer. And so, for example, you could do medical coding, you could do medical billing, you could do adjustment coding, you can do inpatient coding, outpatient coding. They break it down even further than that. So if you wanted to break down even more into outpatient documentation specialties, you can even do that. And then, of course, they're a great sounding board if you have, like, I have a specific question. I'm not understanding why my claim isn't, I'm having a series of claim denying, is anybody else having this problem? And on that sounding board, you can hear from other people, wow, I'm having the same problem. And you can group think it and work through the solution. So a fantastic organization. I've worked with them for, wow, probably 14, 15 years.
Thank you for that. What should a patient do if they receive a bill that they
Mhm.
don't understand?
Oh, that's a good question. Number one, if they receive a bill that they don't understand, first thing they should do is they should call their doctor's office and ask for an explanation. And many times it might be, well, I thought my copay would be $10, not $25, which may not seem like a lot to you and me. For some people, if they're on a very limited budget, that difference might be a matter of groceries this week or what have you. So the best thing they can do is they can call their provider. The other thing they can do is on their insurance card, if they flip it over, they'll see there's a member phone number, and they can call that phone number and they can look up that data service, how it paid, and provide explanation as to why the final bill was the amount that it was described as, and how that math was come up as. Now, many people might receive a bill and they might say, but my service was denied. So if my claim was denied and now I owe the doctor this bill, and you thought, well, but I have insurance, why was my bill denied? You can do the exact same step. You can call your provider and say, I'm not sure why my bill denied. Or you can call your insurance company and say, why are you denying this claim? I don't understand this. So for example, it might say, it'll give a code, and I'm just going to give you an example. This just happens to be one of the explanation of benefits that I'm looking at for a specific insurance company. And this is the note. You're going to love this. It's going to say OA23. And you're going to think to yourself, what does OA23 mean? And it says other adjustments. And it says the impact of prior payments adjudication, including payments and or adjustments, which means absolutely nothing to you and me. But if I call my insurance company and I say, hey, I just got your explanation of benefits. I don't understand what this means. Can you please explain it to me?
Right.
And then what the insurance company can do is they can explain to you, okay, previously what we call adjudicated the claim, or we processed the claim, that bill that the provider sent to us, and we processed it this way first. And then when we looked at it again, we said, oh no, we did that wrong. So we reprocessed it. And so that's why we came up with this new amount that the doctor's probably is invoicing you for. Now, you can say, no, that's not right. And you can appeal it. You can say, no, that's not right. And you can file an appeal with the insurance company, or, a grievance if it's necessary, in order to get that claim reprocessed. Generally, though, those grievances first go to your provider and explain yourself, explain the situation, and say, I'm not understanding this, and let them walk you through it. Now, let's say once more, let's say you broke your ankle, and the doctor sent in a claim to the insurance company. The insurance company denied it, and they say authorization not obtained. Now, you're in the middle of an emergency, and with that emergency, you're going to the hospital, and the hospital, they're the ones that's taking care of this information. It's not really your responsibility to get that authorization. That's the hospital or the doctor's responsibility. So to go back to the doctor to either appeal that or say, no, we do have an authorization. Here's the authorization number, and have that and reprocess that claim. So there might be several different reasons why you may not agree or you may not understand your invoice or your bill from your provider, or the explanation of benefits you might receive from your insurance company.
Now, I'm going to try to speak fluent insurance's code to you and show off.
Okay.
What are the differences between CPT and ICD codes?
Oh, that's a nice one. So
And
one
what the
thing in
heck
medical,
is it?
okay, well, we love to speak in our abbreviations, and sometimes our abbreviations are our abbreviations of abbreviations. But so the CPT code is a procedural code that tells us what we did for that service. So, for example, I used the example of 99214 earlier. That is my CPT code. And so that CPT code is describing the service. It's a current procedural terminology. Okay. Now, ICD is more of your diagnosis code. And so what that says, that tells me, okay, yes, this patient came in to see the doctor. So we have a procedure code of the 99214. But why did that patient come in to see the doctor? And so this tells me what was the reason. So that ICD now stands for the International Classification of Diseases. So it could be something simple. You went to go see the doctor and you were having migraines. And so your doctor is going to build a procedure code, let's say 99214 or whatever the code may be. And then they're going to include another code in a different location, but you'll understand. For the migraine, that's going to be G for golf, 43.909. So those are those little mystery codes that we constantly speak in so that we can say, okay, so they came in for the 99214. They were diagnosed with G43.909. Now, that means nothing to you, but that means a lot to me. That means a lot to me. But, I like to say, well, that's me just being a secret agent. That's my secret agent codes, that here I am, I'm speaking this in a secret agent code to my insurance company so that, so the doctor can get paid for that service.
Now, sometimes emergencies happen. And of course,
Yes.
I think I'll round out the last 4 minutes for a full 30 minutes, and then we'll do a wrap up and all that. If you could tell us for our last question, and then I'll let you have the last say and last question after that. How do emergency services impact billing practices?
Okay, well, the billings for when you're billing for emergency services, there's specific coding for it. So there's specific CPT codes for that. And so your doctor will be billed for the hospital. Let's start fresh. There's going to be multiple people doing billing in this situation, okay? Because there's multiple in different departments involved in this. So, for example, you go into the hospital because you're having chest pains. Well, the first thing they're going to do is they're going to run lab work on you because they're looking for specific markers in your blood to see if you're having a heart attack, okay? So there's a lab billing involved now, okay? Now, the doctor who's coming to see you, okay, you're going to have that doctor billing for you. Then you're going to have the hospital emergency room stay. And so that's going to be the emergency room billing for you. Included in that might be different services, different procedures that they've done. For example, if they ask you to do certain testing, or they ask you to, they say, oh, well, we need to have a specific procedure ran to see, if is your heart in a good condition or what have you. And so with that, you might receive a bill at the end. You thought, I just went to the emergency room. But now, a few weeks later, you get a bill for a lab. You get a bill for the radiologist who looked at those procedures, that, the x-rays or whatever radiological, tests were ran. You're going to get a bill from the doctor who saw you, and you're going to get a bill from the emergency room themselves. And you think to yourself, but shouldn't this all be wrapped up in one bill? And many times it's not. And that's very confusing to people.
And with that thought, what are your last thoughts before you wrap up? How you want someone to maybe reach out to you, what your business's official name is, or if you have an email or a website, or say your phone number twice and slow. If you want people
Will do.
Go ahead.
Alrighty,
Tell us your last thoughts.
Okay, well, my last thoughts is that, for any person out there who is trying to understand their their insurance bills from their provider, again, please reach out to your provider. And when you're not sure still the answer, reach out to your insurance company, ask them to explain it. If your claim is denied, always reach out. Don't just accept the denial. Don't just accept that. So if you get an explanation of benefits from your insurance company, and that's after you've seen the doctor and they basically tell you this is how we processed your claim. If you don't understand it, please give your insurance company a call and they'll explain it to you. Now, what I do, and I do this for both providers and for the patients as well, that if their claim denies and they're not sure how to fight that denial, I help them with that. I help the doctors, and I also help the patients to fight those denials so that they don't have to come out of pocket, because if the claim is denied, many times the patient is billed for that amount, which isn't fair. It's not fair. And so I represent the patient, or I can represent the provider to help with those denials. I can also, help to explain if you've talked to your doctor and you talk to the insurance company, you still don't understand what the explanation of benefits is, I can help you understand that as well. And I have no problem doing that. But to let you know, my name is Suzanne. It is Suzanne, Suzanne. Last name is Barrett, 2 R's, 2 T's. And I am with Suzanne. My email is Suzanne@topdocumentation.com. And that's my company, topdocumentation.com. And if you want my phone number, it is 772-882-1245. Again, that is 772-882-1245.
And it has been great having you on the show, OMG Biz Cafe Talk Live Radio. We'll be covering some interesting topics with Suzanne, like what is the primary purpose of medical billing? How does the medical billing process start from A to Z? The role of healthcare providers play in medical billing. Can patients be billed directly, and how does that work? And a whole bunch of other questions. We just want to thank Suzanne for being here today. I'm Paul Finkelstein at OMG Biz Cafe Live Talk Radio. You could find me on LinkedIn, YouTube, and the Skylar Network. And hang on, Suzanne, as we go off the air, unless you have one last thought before I go off the air.
Oh, no, I just thank you so much for dropping into my afternoon. A nice little surprise to have you join me. So thank you for having me on board today.
Sure. I'm just going to give Tony the last word. Check out Tony's words.
You have been listening to the OMG podcast with Paul Finkelstein. We can help you build wealth without hogging your time. Schedule a one-on-one with us. Thanks for listening. Join us again for another OMG podcast segment.